Welcome to Dentsply Sirona World 2024, where we are showcasing Primescan 2, our first direct-to-cloud, cloud-native intraoral scanner. I know it might look like it, how we have it set up, that this camera and this intraoral scanner is connected to this computer, but it's actually not. All we need is a Wi-Fi signal for Primescan 2 and to be logged into a DS Core account. Let me show you how it works. All we have to do within DS Core is pick any one of our patients, click on Start Primescan 2, and the camera is ready to go. So you notice that we have a new step here called status scan or treatment scan. So what I'd like to demonstrate for you is what's the difference between a status scan and a treatment scan. So when a patient walks into any clinic, we are looking to implement this scan every patient concept. The value to that is now we have the true status of what's happening in that patient's mouth. So all we have to do is click on status scan, wait for DS Core to load, and now we're ready to go. We can simply take our patient, take our camera, place it in the mouth, and start scanning. Primescan 2 is built on the same patented technology as Primescan, so we still have the same accuracy, the ease of use, the precision that we had with Primescan in a new direct-to-cloud format. So all we do is simply scan the patient, make sure we have a complete scan of the upper, lower, and the buccal bite. In order to change from one catalog to the next, I simply double tap on the camera, and you'll see that the scanner now, without having to touch the computer, will move from my lower jaw catalog to my upper jaw catalog, and then I continue on with scanning from there. So simply doing a scan on the patient. Again, double tap to change our catalogs. And there you have it. We just completed a status scan for our patient. So with the status scan and treatment scan concept, what I'd like to demonstrate to you is why we have introduced a treatment scan. So the patient that we just scanned, we did a status scan on that patient. So we really just took a scan of what's going on in their mouth that we ideally can use to help educate the patient on their oral situation. The other value to doing that is the patient we just saw, we were able to diagnose that this patient needs a crown, and they needed a crown on tooth number 30. So when that patient comes back in to be able to have their crown done, we don't have to rescan the whole patient. All we have to do is tell DS Core that we are doing a crown on tooth number 30. DS Core is going to ask us if we want to use that original status scan for our treatment. So we can simply tell DS Core, yes, we want to use that status scan. And now what it's going to ask me to do is simply scan my tooth number 30 where I've prepped for the crown, making a much faster and more efficient flow within the dental practice and a much quicker appointment ideally for the patient. So as you can see here, the DS Core is simply asking us to scan for our treatment scan. So all I have to do is go in, scan over top of my prep, and you can see that DS Core is now mirroring the treatment scan and the status scan to give us a complete situation to be able to design a crown or to send this off to a laboratory to have a crown made. And so that's all the scanning I have to do once the patient comes back for their treatment. So as you can see with Primescan 2, we have no cord. We are scanning directly in the cloud. It is built on the same patented technology as Primescan. So we have all of those great principles that we grown to know and love with Primescan in a very sleek, well-designed format here. As you notice with Primescan 2, the tip of the camera has actually been re-engineered. It's sleeker and more sloped than Primescan. What this gives us the ability to do is scan a lot easier in the back of the mouth. So scanning behind that terminal molar on a patient is a lot easier with Primescan 2 due to the shape of the tip. We also are using disposable lenses at this point, which just is a lot more hygienic when we're navigating within the operatory. And really the idea behind Primescan 2 is we can scan every patient. So as soon as I'm done scanning, I simply clean the camera, pass it on to the next user, and now I can continue everything that I want to do for that patient directly in DS Core, really enabling us to execute on that scan every patient concept.